I am Pat Gilroy, and I am the de facto leader of the Facebook group Got Diabetes Insipidus. I wasn't expecting to be the leader of this group, but I really, it's really my passion. I have diabetes insipidus, what it was previously called. It's now called Arginine Vasopressin Deficiency, which is quite the mouthful. So we frequently call it AVP deficiency. We have 6,900 members, 6,900 members in the Got Diabetes Insipidus group. I have to get used to not saying that in the AVPD group. And we have 4,000 members that are actively participating at any given time. We have members from all over the world, primarily patients that have AVP deficiency or have children with AVP deficiency. And because it's such a rare disease, with 1 in 25,000 people having it, it's really, really difficult to find physicians that understand what it is, who take these symptoms seriously, and also understand the process of the diagnosis, and especially in treatment once somebody's been diagnosed with it. So thank you for letting me come and share this information today. We need to get as much information about AVPD out as we can so that we can help all of those people that are trying to find their way.
Can you briefly give us a definition of AVP deficiency or central diabetes insipidus and share your personal journey with this disease?
You bet. Central diabetes insipidus, which now has a new name, is of arginine vasopressin deficiency, is a condition in which what I tell people is, my body no longer will keep fluids in it unless I take a synthetic hormone. So AVP deficiency is when you can lose between 3 liters to over 20 liters of urine per day. You need to make sure that if you're losing that amount of fluid, you need to make sure that you're drinking that amount of fluid. And as you can imagine, somebody who is losing 20 liters of urine a day, that's pretty much takes up their whole day, having to spend time using the restroom and drinking, because otherwise we would totally dehydrate very rapidly. So it can be a really very dangerous condition. If you don't have enough fluids, if you don't have access to restrooms, it makes it difficult to work, it makes it difficult to travel, it makes it difficult for most of the normal functioning for people in their daily lives. And it's very upsetting when you start to have these symptoms, and it's very scary, you don't know what's going on, and it's difficult to get physicians to understand what's going on with you and to be able to treat you. I consider myself somewhat lucky, not that I have the condition, but the diagnostic process for me was very easy. I had something called a Rathke's cyst pouch on my pituitary, and what it did was it caused a number of different issues for me, and I was having visual symptoms from this cyst pressing on other parts of my brain. So it was pressing on my optic nerve, and I was in danger of losing my vision. So I had surgery for it, and when they removed that Rathke's cyst, it bumped against my pituitary and it caused diabetes insipidus. So within a few days of my surgery, I knew that there was something very wrong, and I was continuously needing to go to the restroom and was very thirsty. I was immediately given the primary medication that's used for it, desmopressin, and it was wonderful. All of a sudden, I had no issues with thirst. I had no issues with having to run to the restroom immediately and frequently. So, but I didn't understand how to take the medication, and I took too much of it, and I drank too much, and I ended with diabetes insipidus and desmopressin. The desmopressin keeps nearly all of the fluids in your body once you take the medication and drink. So I thought, wow, this is great. I'll just take the medication, and why do I have to go to the restroom so often anymore? I can just take more medication. And I did. And I ended up diluting my blood. And that's called hyponatremia. And that's a very dangerous medical condition. And it can cause, if it gets really bad, it can cause confusion, it can cause vomiting, it can cause seizures, strokes, it can even cause death. So understanding that desmopressin is a wonderful medication, and can allow us to live nearly a normal life, it can also be very dangerous. And not very many physicians or pharmacists understand how critical it is for patients to understand how to manage their arginine vasopressin deficiency and desmopressin safely. This is particularly critical for parents who have children with this condition, and the children can't tell them how they're feeling. They can't tell them if they feel a little off, or they can't tell them if they're thirsty. They frequently can't tell them if they need to use the restroom. And parents really have to just interpret the soft signs of what's going on with their children.
What are some of the challenges that patients face when diagnosed with AVP deficiency or essential diabetes insipidus?
Unfortunately, we do not have the benefit of a monitor for determining what blood sodium levels are, and if we're diluting our blood or we're getting dehydrated. We don't have ways to measure that easily. You have to go to a lab to get your blood drawn and have it measured, to see what's going on with your electrolytes. And so it can take anywhere from, well, for me, I have to make an appointment several days in advance to go to the lab to be able to get my blood drawn. And then it used to take 2 to 3 days after that to get the blood results. So one day I'm not feeling very good. I have to wait 5 days to find out what my results are for my blood electrolyte and sodium levels. And during that time, I can start into these seizures. I can start into all of these other issues and end up going to the emergency room. I could end up hospitalized. We've done a number of surveys with patients with AVP deficiency, and we found that a really high percentage, even 40 to 50% of people with this condition that completed the surveys, had been hospitalized because they diluted their blood when they didn't understand the importance of managing it well. There are very specific rules that we tell members of got diabetes insipidus about how to manage it. And we suggest, well, actually, it's more than that, it's more than a suggestion. We advise them that to be safe, what they need to do is they need to let the medication wear off daily or several times a week. And they need to wait until they run to the restroom at least 2 or 3 times with a very full bladder and have nearly colorless urine, excuse me. And that is showing that you're getting rid of the excess fluid. Once you get rid of that excess fluid and you start to develop a huge thirst, then it's safe to take desmopressin again. So those are some of the major issues that we have. Another major issue that we have is just getting physicians to understand, to begin with, what is going on with us. Typically, a patient will go in to see the physician and say, I can't stop going to the bathroom. I'm going every 15 minutes. I'm going every half hour. It's terrible. I can't do anything. I'm really thirsty. And the doctors go, well, many patients have been told, it's just It's just habit. It's just anxiety. It's just reduced how much you're drinking, and then you won't have to urinate as much. And or they'll be told for children, oh, it's just a way to get attention from you. You know, it isn't anything. Just restrict their fluid. And adults who have this condition and that started as children will tell you that it was torturous. And they were so thirsty. And it is a survival, it's a survival drive to drink. Um, they are so thirsty that the children will drink pet water, they'll drink water out of aquariums, they'll lick plants that are wet. They will, somebody was saying that her daughter goes out and drinks the water from the chicken coop. Um, they will drink vinegar. They will drink anything. It's a survival mechanism. It's just an unbelievable drive. It's really a base animal instinct to get that fluid. So those are some of the issues. And then what we tell patients is measure your urine. And we talk about urine, and we talk about very personal issues that other people don't really understand. And so we really try to give patients guidance all the way from the part of, I have these symptoms, I don't know what it is, what should I do, how do I get doctors to pay attention to me, all the way through the diagnostic process. And with children, it's when they have arginine vasopressin deficiency, they often have at least 40 to 50% of the children either have a genetic mutation, or they may have a more serious condition like a histiocytosis condition that can be systemic, or they may have a type of childhood cancer that can also be systemic. And so an AVP deficiency can be an initial symptom of these other medical conditions. And so it's really important that there is a complete and very thorough investigation as to why someone comes up with AVP deficiency.
What are some of the most common misconceptions when it comes to this rare disease? And why is it so important to raise awareness?
One of the major issues that patients have is confusion with the medical staff, because it's been called diabetes insipidus so long, and I'll tell you why it was. Diabetes mellitus and diabetes insipidus both have some similar symptoms, in that people who have diabetes mellitus typically urinate quite a bit, certainly not as much as people with diabetes insipidus, but they urinate quite a bit. Diabetes mellitus, originally, one of the things that would be done to determine whether it was actually diabetes mellitus was to taste the urine, and it was sweet. And for diabetes insipidus, they would taste the urine, and it was nearly colorless because it was so dilute. Anyway, there was no taste. And so because of the similar symptoms, unfortunately, diabetes insipidus was the name. And over 58% of patients on a survey of 1,034 patients said that their medical providers had confused the two conditions. And that has caused anything from constantly being asked what your sugar levels are, and can I check your glucose level, please, to patients being refused fluids in the hospital, not getting desmopressin, and it's actually it's caused deaths. A man even called 911 from a hospital, and the police came, and the nurses said, oh, he's just psychotic, you know, he's just having a mental breakdown, and he died the next day from dehydration. So there's been a major effort, and it started in the fall of 2022, to change the name, because these medical errors from misunderstanding just can't happen. So it's been changed to arginine vasopressin deficiency. Arginine vasopressin is the hormone that's secreted from the pituitary that tells the kidneys to keep fluids, don't send them out. And people with arginine vasopressin deficiency don't have enough of that hormone that signals the kidneys to keep fluids. So the new name is long, but AVP is the acronym for arginine vasopressin deficiency. So now the new name is AVP deficiency, or AVP with a dash D. And we want to make sure it has the dash, because otherwise it's a personality disorder, and we don't want that mixed up. So it's really important that people understand what the condition is, how to manage it, how to be able to get the medical community to pay attention to them. So many people have gone to a number of doctors to be able to be diagnosed.
Could you please tell us about the survey that your Facebook group is conducting with WAPO?
A really important effort is being done. I've been working with, as a member of our group is a member of WAPO, and we are doing an international survey that's going to be released very soon. And so we hope that we can reach as many people with arginine vasopressin deficiency to be able to take the survey, because it's really addressing and asking about all of the different issues that patients are having. And we expect that we're going to have quite a bit of information that we'll share at international presentations, both to the medical community and to patient communities. We also expect that the information will yield a number of medical journal articles, and also a number of presentations in medical conferences, as well as in different patient organizations that are supportive of patients with pituitary issues.
What advice would you give to someone who has been newly diagnosed with AVP deficiency or central diabetes insipidus?
We actually need to do more. I have written some guides in our got diabetes insipidus, got AVPD deficiency, so that new members can go in and find real specific information. We also answer a lot of questions, but one of the most important things, if somebody's been newly diagnosed, is to understand that generally desmopressin is started at a very low level. And what physicians need to find out is, how much it's working for the patients. And so we always recommend that patients new to desmopressin will write down and keep a journal of when they take the medication, when it starts to wear off, and they can even include how frequently they urinate or how much they urinate. And all of these records give the physicians information to be able to make decisions about if the desmopressin needs to be increased, if it needs to be decreased. And it also gives the patient information. Tracking your urinary output is really an important part of being able to manage it well. So even parents of very young children, we ask them to get a kitchen scale and weigh diapers and keep a record of it. For people with adults or older children, we suggest that they get urinary collection devices that have measurements on the side, and they keep records of them so that they can learn what it feels like to urinate different amounts. They can get used to looking at the color of their urine, because that will indicate when they need to take more medication or when they need to not take more medication. So it's really learning to read the signals of your body and how much fluid that you have in, if it's about the normal amount, if you're getting too much fluid, if you're getting dehydrated. So all of those things are things that we learn, or we hope that patients with AVP deficiency learn, so that they can manage their medication safely.
What are some of the improvements that you would like to see in the management and treatment of this condition?
One of the major things, I already mentioned how long it takes to get a blood test. One of the things that a foundation that was started by a mom of a child who had diabetes insipidus actually had to have brain surgery and have treatment for cancer. Anyway, she started the foundation, the Raymond A. Wood Foundation, and they are developing with other medical organizations a blood sodium meter that you can have at home, that you can check your blood at home whenever you want to. It's going to take a couple of drops of blood. Right now it takes a minimum of 20 drops of blood to find out what your sodium levels are. And they expect to have this on the market by 2027. And it's going to make a world of difference in the management and how safe patients can be to have these in their homes, just like the glucose meters that are out there now. And that would be the greatest improvement of anything that we can consider. Although some people would like it also to be able to attach it to your body so you can get instant readings anytime, and then also have it provide the medication at the right level. So those are some of the wishes. If that was our big wish and we had a magic wand, those are the kinds of things that we would ask for. The Raymond A. Wood Foundation needs about $1 million more to be able to bring it to the commercial market. So we're really hoping that those funds can be found and can be raised, and that all of us can benefit from having that available. And there's a much wider market for it besides people with AVP deficiency, but that would be wonderful.